This is a preliminary report to governing authorities for assessing public health preparedness and observations from the emergency response to H1N1 in Tennessee of 2009 to 2010. The Government Task Force for Disaster Preparedness advises the governor and other officials as how to best prepare for the next pandemic flu. The task force focused on 4 areas. First, vaccination distribution. This includes a history of pandemics and lessons learned from previous experiences. Second, public communication. This includes federal guidelines and public health emergency communication and the different capabilities that are needed. 3, surge capacity for healthcare settings, which also includes primary and secondary effects to which you have to plan for. And 4th, public-private partnership and planning, which is a concerted response by all stakeholders involved.
In this section, we'll talk about the distribution of vaccines. Considering the ramifications of having the H1N1 virus spread throughout the state, it was important for state leaders to take a quick, decisive action. It was imperative to get the ball up and rolling so that they could control the outbreak of the H1N1. A key factor in containing the virus was distribution of the virus. In order to get the vaccine out to the masses, there needed to be a group that spearheaded the effort. Therefore, the state activated the State Operations Center, also known as the SHOC. In the past, the vaccines were distributed by a few clinics and throughout the manufacturers. Now we'll talk about the background of the distribution of the H1N1 vaccine. In the past, the vaccines were distributed by a few clinics and through manufacturers who worked with the CDC and partnered with certain clinics. This process proved to be flawed, and more knew the process did not work during the first outbreak of the H1N1 virus, and therefore brainstormed with a group and came up with a new approach, taking the following into consideration. 1. Who needed the vaccine? Children and the elderly were pushed towards the front of the line. 2. How could we make sure that everyone who needed the vaccine received it? And 3. How could we estimate how much of the vaccine would be needed? In the past, the vaccines were distributed to a limited number of clinics that participated in the federal Vaccines for Children program. However, with the H1N1 virus, it made sense to have the distribution of the vaccines using a larger distribution method. Therefore, Tennessee came up with a plan more conducive to their environment. The plan in place was to mimic the procedures implemented by Texas, which included working with the federal government and the CDC to distribute the vaccine to local clinics, doctors, and pharmacists throughout the state. This allowed people in rural areas to be able to receive the vaccine. Those who needed it no longer needed to travel several hundreds of miles or a bunch of miles in order to get to a place where the vaccine was distributed. The vaccines were distributed on a local level, making it easier to contain the H1N1 virus. Making recommendations for the future, we recommend that in emergencies, using vaccines work on building the infrastructure that can handle the distribution effectively. Ensure that the information kept in the database is current and up to date, allowing you to tap the needed resources and be able to act swiftly with responses to the public, the media, and those needing the vaccine in order to contain the pandemic.
Thank you, Nia. I'm going to be discussing the task force recommendations in the area of public communications. There are several areas of general communications guidance within the task force report, but for the purpose of this summary presentation, I want to focus on two in particular. First, the National Strategy for Pandemic Influenza provides quite a bit of guidance for public communications during a pandemic influenza outbreak. To summarize, policymakers should work to ensure clear, effective, and coordinated risk communication during a pandemic in order to effectively convey helpful, informative messages that are timely and delivered to the general public, the private sector, and other stakeholders by trained spokespersons who are educated in risk communication. By way of example, the top photo on the right of this slide is a press conference of the Shelby County Commissioner, that's the county of Memphis, Tennessee, discussing possible cases of swine flu. Note the professional authorities that were made available during the press conference, as can be observed by the physicians in white coats. The messaging itself should provide three things. First, guidance to individuals on infection control behaviors they should adopt pre-pandemic and the specific actions they will need to take during a severe influenza season or pandemic. Second, the communications program should provide educational campaigns on pandemic influenza and public and private interventions. And third, guidance to the private sector and critical infrastructure entities on their role in the pandemic response and considerations necessary to maintain essential services. Within these communications, the STARK principle should be applied. The STARK principle, as given by DHS in the Pandemic Influenza Preparedness, Response, and Recovery Guide for Critical Infrastructure and Key Resources, is an acronym for simple, timely, accurate, relevant, credible, and consistent. It's also important to remember that the communication demand of different audiences will vary, and one should determine how to tailor messaging for each of them. Looking at each of these categories, other government agencies, healthcare professionals, the general public, and private sector businesses, it's easy to identify differences in communication content and demand. For example, healthcare professionals may want very different technical information on vaccines and medical treatment, while this level of detail might confuse and distract the general public, who's most likely interested in vaccine availability, behavioral guidance, and the current spread of the pandemic. Now that we've addressed some general rules for messaging, as well as audience-related considerations, let's focus on how to get the message out and what messages should be given priority. The state should leverage three resource areas to ensure effective message distribution. First, and this is something that Tennessee did very well in the 2009 H1N1 outbreak, close collaboration with the media. During times of crisis, the media is the primary information portal for the public. Working with the media to establish ground rules for information distribution, as well as encouraging media participation in pre-pandemic scenario-based exercises to develop communications plans, is critically important. The top photo on the slide is an example of WMC-TV in Memphis doing a special report on swine flu. Second, the state should leverage technology, both old and new, for effective communications. In the old category, CDC and the Tennessee Department of Health telephone hotlines are maintained for both clinicians and the general public. They allow for interactive, real-time pandemic influenza communications. Public officials should ensure that these hotlines are equipped to provide the public with contact information for local volunteer groups and government agencies that provide financial, physical, and psychological support to pandemic influenza victims and their families. New technologies that can be leveraged are internet-based resources, including the TDH, CDC, and DHS websites, and the TDH Tennessee Health Alert Network, also known as THAN. THAN is a secure web portal used specifically for contacting regional and county public health offices, hospitals, and first response personnel. Also, the Tennessee Volunteer Mobilizer, or TVM, is a web-based